Welcome, everyone, to the Hartford Institute for Geriatric Nursing at NYU Rory Meyers College of Nursing's first webinar on COVID-19. We are delighted to be with you today. I am Dr. Tara Cortes, the Executive Director of the Hartford Institute for Geriatric Nursing and a professor at the NYU Rory Meyers College of Nursing. Joining me today will be Dr. Donna McCabe. Donna has her doctorate in nursing practice, and she is a nurse practitioner certified in both geriatrics and psychiatric mental health nursing. We are delighted to have Donna with us today. She is an expert, as you can tell, in the care of older adults. Welcome, Donna. And let's start by you telling us, please, what are the risks of COVID-19 for older adults living in the community? And also, what should their primary care providers be prepared to tell them about their risks and how to prevent getting COVID-19?
Absolutely. We know that COVID-19 is a virus that causes a severe respiratory syndrome. And we know that all people are susceptible, regardless of their age, gender, or any other characteristics. But we do know that advanced age, as well as the presence of chronic conditions such as diabetes, heart disease, or chronic lung disease, for example, place older adults at a much greater risk. And you are also, as an older adult and or living with a chronic condition, at much higher risk for becoming seriously ill from COVID-19. So this is something that we really have to take into consideration and stress for the people that we're taking care of, and also for the people that are taking care of older people, because similarly, they need to follow the same very kind of strict precautions. A very sobering statistic that the CDC has is that 8 out of 10 COVID deaths reported in the United States are adults over the age of 65. So we know that those are the individuals that become severely ill and can even die from COVID. They are the ones that are being hospitalized, spending time in intensive care, and being placed on ventilators. So very important for older persons and those that they live with to protect themselves.
What are some of the recommendations that you have? Specific recommendations. We hear so much on the news about do this, don't do that, this is good, this is not good. What are your ideas about the kinds of preventive actions that people can take?
Perfect question. So I think about, always going back to the science and following the recommendations that we have from the CDC. So again, for all people, but particularly for those at highest risks and the people that live with them, we want to limit our interactions with other people as much as possible. And I'm going to caveat that because I know we're going to speak about this later. We want to limit in-person interactions because we don't want to limit, we don't want to cause harm from isolating people, but we do want to limit interactions, in-person interactions with other people as much as possible. And when we are interacting in person with other people, we want to make sure that we're following the correct precautions. So what are these precautions when we are interacting with other people outside of our household? We want to wash our hands often. And sometimes it sounds like something that's so common sense, but I will tell you that a lot of people don't wash their hands correctly. So it is worth mentioning how to wash your hands correctly and how often you need to do it. So we want to be able to teach a person or have the person wash their hands for at least 20 seconds. And they use the recommendation to sing happy birthday twice. And that's something that I would recommend, to make sure that you're using soap and water covering all surfaces of your hands and washing them for 20 seconds. And considering particularly after you've been out in a public place or after you have touched your face or blew your nose or coughed or sneezed, those are particularly important times to wash your hands. Washing your hands is best, but if soap and water are not readily available, we should be using hand sanitizer. And the hand sanitizer should be such that it has at least 60% alcohol content in it. And there are a lot of different hand sanitizers that are out there. So that's something that you want to make sure that you're using one that's effective. And you can read the label to see that it's 60% alcohol. And with that hand sanitizer, you want to be able to cover all the surfaces of your hands, rub them together vigorously, and then allow them to dry without using a towel or rubbing off any of the sanitizer. And then along with that hand hygiene information is also to make sure that you're telling your patients as much as possible to avoid touching their eyes, their nose, their mouth, particularly when they're outside in public places or outside of their homes with their unwashed hands. The rules and the recommendations surrounding close contact with other people. So within your household or your pod, the people that you're normally with, you can have regular interaction and contact. What we're most concerned about is when either people you go outside of your home or people come into your household, and that's the individuals that we want to avoid close contact with. So we want to keep 6 feet distance between them and ourselves. And it's hard to have a tape measure to know what 6 feet is, but we recommend 2 arms length. So if you really kind of can stretch yourself out and see, it's a good bit of distance. And considering for an older person also who might have some sensory deficits, if you're with your person or, just take into consideration to, if they're trying to hear or see another person, that we might have to just take an extra effort to make that effective while keeping that 6 feet distance.
I live here in New York City, and I am really amazed. I'd say probably only 1 out of 100 people does not have a mask on as I walk down the streets. And of course, we've been able so far to keep our infection rate under 1%. So from what I see, it seems masks are helping, but would you talk a little bit about masks and what kind of masks people should use?
Yes, absolutely. Masks are definitely helping. And I think some of that controversy that was out there in the beginning, we got mixed messages about masks, but that has definitely been given to us loud and clear. We should be wearing masks when we're out in public places or when we're in close contact with somebody who, is not within our household. What we know about masks are that they are, or face coverings, that they're primarily intended to protect others. So taking it from, we should all be protecting others and we should all be protecting ourselves as well. So that's the primary intention, is to protect others. But by us wearing them, by an individual wearing them, we're still going to get some benefit of protection. And it's also important to know that we can still catch the virus even though we have a mask on, and others have a mask on, because we know that the virus can also be transmitted from mucous membranes, from our mouth or in our eyes or nose. So those are just some important kind of background pieces about the mask. As to what type of mask, this is another very common question, and talking to patients and my loved ones, I always go back to the best science that we have available. There have been some studies that have compared the different mask materials for what we are recommending for the general public, right? So this is not for healthcare providers. This is the masks and face coverings that the general public should be wearing. They say the bottom line is consider comfort, because comfort is going to dictate that it's going to be tolerable and it's going to be able to be worn by the individual. So that's kind of first there. So considering what's comfortable for the individual. We know that plain surgical masks have a slight bit more protection than the cotton masks. So, because some people may find them a little bit lighter and a little bit more comfortable, particularly if the older adults that we are caring for, somebody else is caring for, is perhaps living with dementia, that the comfort level and the lightness of a surgical mask could have a little bit of bearing on whether they're able to tolerate it. Another piece is that you might have seen some people outside wearing masks that have a valve on the outside. And this is an important piece here, because these valves, while they protect the what's coming into the person, they don't filter anything that's going out. So these masks are not recommended at all. So we do not want to use any masks that have a valve. And in some states, it's been built into their law mandates on masks that these can't be worn. And we also want to take into consideration that there are some people who can't wear masks. And I think this is important for the public to know, and worthwhile for us as healthcare providers to share with our patients, is that if somebody has trouble breathing, if somebody is unconscious or has severe cognitive impairment, and they're not able to take off the mask themselves, they can't wear a mask. And for those older adults that can't wear a mask, of course, we would really, really caution them about going out into public or having them interact in close spaces with people outside of their household.
Two things about masks, because one of the things you said about masks is that, but they don't really protect you, and I think that's they may not protect you completely, but they lower the risk dramatically, I believe, is what I understand. Lower the risk dramatically if everyone has a mask on, lowers the risk of transmission from the other person, and lowers the risk of your inhaling the molecules, the minuscule molecules that it is carried on. Is that correct?
That's correct. There's a wonderful visual that the CDC has also, right? So we can see the transmission, a kind of a diagram of the transmission for individuals in close contact with neither person wearing a mask. And then we can see the transmission for one person wearing a mask, and then for two people. So you're absolutely right. There is protection on both sides. I just bring it up for the science, and perhaps to have that piece of information also for somebody who may be the naysayer, perhaps on masks,
Yes.
to have all the information present. My other caveat for masks, if I could say too, is that it doesn't replace social distancing. So we still want to, have those two pieces together.
Yes. I also think an important thing you said is about the transmission through the mucous membranes, because one of the, I have heard that it can be transmitted through the eyes. So even though your mask is covering your nose and your mouth, you must be careful not to be touching different surfaces, and then that might have COVID having landed on it, and then rub your eyes. So I think that is, when you said about the mucous membranes, it reminded me of the fact that rubbing your eyes with dirty hands is another factor that has to be avoided.
Absolutely. And even the droplets can travel into our mucous membranes in close enough proximity.
Yes. Donna, also, I understand that with the cloth masks, a lot of people make homemade masks. I know I've bought masks from different companies. My masks often come with a filter or something that goes inside, because what I've heard is that it should be at least 3 layers thick. So if you have an outside layer, an inside layer, and something in between, and people have told me they've used coffee filters or vacuum cleaner filters to put between the 2 layers, that is helpful. But the rule of 3 layers is pretty standard. Is that correct?
That's been the general recommendation. But again, if I go by the science, we don't have a perfect science for these recommendations. And when we go back to that bottom line about making sure that it's tolerable for the person, that's an important piece also. So yeah, we would know that the thicker the material or the more layers, that's going to have the more apt to be protective against the virus being able to go through that material. But also know that, we want to make sure that it's something that the person is going to be able to wear, and the information and the science is really coming rapidly. So I would also encourage everybody to stay on top of the CDC website, and you'll even see what gets out there to the public. Just recently, big information about those gaiters, right? The scarf type masks that you pull over your mouth. They were said, well, they're no good. We shouldn't be wearing them. And then 2 days later, another report comes out saying that they are okay. So it really is important that we keep up with the information as much as possible as it's changing, very rapidly.
Well, let's talk a bit about symptoms. What kind of symptoms should older adults in the community be aware of should they experience something that's unusual?
Yeah, we really want to be able to be to teach folks to be alert for symptoms and really to monitor their health on a daily basis. Right, we kind of always do that, but in this time, we really want to be vigilant to that, and also for if we're taking care of people who are caring for older adults to help monitor their daily health also. So what we know about the transmission and the symptomatology of COVID-19 is important, because we know that, the other piece here is that we didn't mention when we were talking about the transmission is that we know that it can be transmitted from somebody who's not showing any symptoms, because the symptoms can take from 2 days to 14 days to appear. So that's really a long window of time from exposure. So even if you're thinking that, your patient, your family member has gone out maybe 10 days ago, that wouldn't be time enough for, exposure. It does have that long length of time where the possibility for symptoms to appear is present. What we know is fever, cough, shortness of breath, lethargy, fatigue. And these are pretty common symptoms. We're worried about the flu season that's coming upon us also. These look very similar, and they look similar to any other respiratory type, upper respiratory type syndrome. We know that older people, people who are living with chronic conditions, people living with dementia in particular, can present sometimes atypically. So something as subtle as a decrease in appetite, perhaps a little confusion that wasn't present before is something that we should really be keyed into, because again, those atypical symptoms for somebody who's older are important. And also the fever. So we know that older adults, as they age, their immune response lessens. So while we know that typically we register fever as 100.6 Fahrenheit, an older person, their fever may be registering at a lower point. So it's important for somebody to know their baseline temperature. So while it's usually 98.6, an older person might have a baseline temperature of 98. And if it goes from 98 to 99, that's something that we want to be concerned about. So that that nuance of an older person with the characteristics of a fever is important to consider also. And I think also worth saying at this point too, because with all that's going on with COVID, hospitals and going to physician offices has been something that we've been trying to avoid, just because it's another outdoor exposure possibility. But we want to make sure that people still know that emergency symptoms need emergency treatment. So if you have somebody, that is experienced, you want to make sure that the person knows if they have trouble breathing, if they have chest pain, if they have, acute onset of confusion, inability to stay awake, we want to make sure that they're getting to the emergency room, they're calling 911, and they have fast action for those symptoms.
Yes. Donna, you mentioned the flu season is coming up, and I just saw it, I think this morning I saw it, the fall talked about as being the twindemic. And there's a lot of urgency in terms of getting a flu vaccine. Would you talk a little bit about is there an advantage or a disadvantage to getting a flu vaccine now in August, September, as opposed to waiting until November when perhaps you might need it more? Will your immunity become less if you get it earlier? Mm-hmm. Are there pros and cons to that?
It's a great question, and we're definitely worried about the flu season coming combination with dealing with COVID-19. The recommendation is going to be to get the flu vaccine as soon as you can, because we know that the coverage generally lasts for the season, for the flu vaccine. So we do want people to get it as quickly as possible. And we also know that once somebody gets the flu vaccine, that it takes about 2 weeks for the vaccine to become effective. So that's another piece of information that's important. And having the flu vaccine does not give us any other more protection to be out in public places or to lapse on any of our social distancing responsibilities or face covering responsibilities. It's really, we want to make sure that we're treating it as another layer of needed protection for everybody, and particularly for older adults.
That's a very good point, and I think an important point to really hone in on, because I think it could give people a sense of false security. Well, I've got my flu vaccine, so I'm okay, and I don't have to wear a mask, or I don't have to wash my hands or social distance. So it really is going to be, I think, an important message for this flu season to get out there. Just because you've had a flu vaccine does not mean that you are still that you are also immune to COVID-19. They are two very, very different strains of a virus. It's interesting. That's going to be an important message.
Absolutely.
Would you talk a little bit about nursing homes? Nursing homes have gotten really hit hard with this pandemic. You mentioned before that 8 out of 10 people who have died are over the age of 65. The majority of those people have died in nursing homes or were nursing home residents who went to the hospital. Would you help us understand a little bit about the infection control precautions in nursing homes? And I think also assure the public that nursing homes are doing everything they can to put into place and assure that they have appropriate infection control to mitigate the spread of it as much as possible.
Absolutely. And I also, worth mentioning at this point too, because we use different terms and language matters and what people understand. So we use that term nursing home, and that's what a lot of our patients and families and the public will understand. Sometimes you'll hear skilled nursing facilities, short-term rehab. So we know that these long-term care facilities, nursing homes, are places where individuals go for long-term care, who need help with all of their activities of daily living. They also house short-term rehab, where a lot of patients go on a segue from after they have an acute hospitalization, they spend time at a short-term rehab before returning home. So you want to make sure that people understand that that's both of those places are housed within what we call a nursing home. And they have definitely been devastated, or the folks that live in there have been devastated during this COVID-19 pandemic. What we want to understand and have other people understand is that this is a very contagious respiratory virus. So when we have the combination of people living in close proximity, as they do in a nursing home setting, plus they have those risk factors of advanced age and also of having chronic conditions, and then plus or minus having acute active conditions, the risk is that much more. The Center for Disease Control has been very instrumental in kind of making sure that these facilities are ramped up and prepared to manage the influx. So should the numbers increase, or should the virus in the particular area where the nursing home is have another surge, that they're prepared. So some of the guidance that the Center for Disease Control has provided for nursing home facilities is to, first and foremost, is to make sure the leadership is present. So we're now required that all nursing homes with more than 100 beds, which is the majority of our nursing homes, they have a full-time person that's overseeing the infection prevention and control. And that's important because that person is really going to be able to coordinate all the efforts. There's been a huge push for education. And this education is targeting the people that are there. So we call them residents or patients. Also the healthcare personnel that's there present and all the other staff, and the visitors that may or may not come into the facility. I'll mention that in another moment. So how they should be taking care of themselves and what protective gear that they require. Something that is also really important here is that the people that are coming in to the facility are often of great concern for bringing the virus from the outside. So we don't want people who are not well, who are sick, or who have had exposure to come to work. So this really requires that the nursing homes have very strict sick leave policies and effective sick leave policies where individuals feel that they are able to call in sick, not show up to work, and not have punitive actions or financial implications. So having those really effective sick leave policies is important. For the protective equipment, all staff, healthcare providers and ancillary staff or administrative staff need to adhere to the policies that we talked about for precautions. So in the facility, everybody needs to wear a face covering. Everybody needs to, when possible, have the social distance of 6 feet. Understanding that that's not always possible when they're direct care providers, but as much as possible to maintain that distance. So people in the facilities the patients, the residents have been advised to, if they're outside of their rooms, to wear a face covering if tolerated, as we described the characteristics of what that face covering would be. Unfortunately, the nursing homes have had to limit some of their activities, which, they have workarounds, but the activities and the usual activity and recreational and communal dining has been curtailed in facilities now to make sure that they're able to adhere to the social distance recommendations.
Well, taking that one step further, social distance also makes me think about social isolation, which has been talked about a lot in terms of nursing home residents. It has been very hard, both on families and on residents in long-term care, to be separated. We're now going on 6 months in some of these nursing homes where people have not been able to hold, to hug, to touch their loved ones. People have died alone without their loved ones able to see them and say goodbye. And, there has been technology that's been used to some great extent or lesser extent. It's been helpful. But I think a lot of residents have not been able to leave their rooms. Some nursing homes have given them meals in their rooms so that they avoid the congregate eating. It's been a very difficult time. So can you address whether we've learned any lessons from this? I wonder, if we have a surge again or another pandemic. People say that pandemics are going to become more and more common as humans and animals live closer and closer together. We have fires. We've used up a lot of the space that animals used to live in, so we're more in closer proximity with them. So there will be more transfer. So everyone's anticipating we'll have more pandemics. What lessons have we learned about social isolation, and what are some of the things we should be doing going forward to make this better?
So important. They're now calling it the mental health consequences for all people, but particularly for those at the highest risk and who have been isolated to the greatest degree. We're so concerned about, that's the next coming pandemic. A wonderful phrase by our own Dr. Baywu from the Hartford Institute. She says, there might have been a little trouble with the public messaging that came at first. And she says, we want to encourage physical distance and social connection. And I think that is so powerful because for these, older adults, particularly the highest risks, living in a facility, perhaps those who are living with, functional impairments, and, really are the people at greatest risk. How can we keep them connected? These are individuals who, prior to the pandemic, were at great risk for social isolation and loneliness. And it's a public health issue. Social isolation and loneliness, we know, increases depression. It increases cognitive impairment, or the presence of cognitive, worsens cognitive impairment. It can worsen chronic conditions. It can hasten death. So the implications for these are not simply social. They are implications for the health and well-being of somebody in as a whole. So we really want to make sure that we're addressing them. Nursing homes and other facilities have had to ramp up quickly to try to circumvent the consequences related to this social isolation. There's a lot of generosity has been seen from the public and different foundations to provide and increase the availability of technology through iPads and different kind of tablets to be able to connect folks via text messaging and any kind of video chat. Telephones are still effective, right? Just to have a conversation. So we really have to make sure that we're, again, encouraging the social distance and social connection at the same time. Different things I've seen in nursing homes, that they're even using their public address system more to connect people, to talk about birthdays, to talk about positive events, and to really make people feel connected. Because while we know that this, social isolation, right? That's the inability to connect with others physically, right? But the loneliness is really that lack of connection that we feel internally. And that's something that we can circumvent. It'll take the effort. We can use technology, use phone calls, make sure that we're thinking about people at all times and how we can make them feel more connected.
That's very helpful, I think. That is Dr. Wu's statement. She's done a lot of research, I know, on social isolation, particularly in terms of COVID-19. And it is the physical distance is different than the social isolation. However, I still think that for older people, for grandparents who have been unable to hug their grandchildren, it's really very difficult. And I think that problem is going to get harder in the fall when kids go back to school. During the summer, a lot of grandparents, a lot of multi-generational families were living together, their the grandchildren.
Mm-hmm.
And you were all kind of in a bubble, and you could have that contact. Once kids go back to school and they are in that much greater context of risk, I think that we're going to go into another phase of greater separation of older generations from the younger generation, which can create a whole other issue this fall. So every day we learn, though. We learn from our experiences. Donna, you want to say, I was going to move on to healthcare workers, but was there something else? Okay, because we've talked about the patients. Oh, Donna, you want to say, there's something else you want to say?
I did it just because I feel very passionate about the social connection and how we can help mitigate the loneliness for individuals. I mentioned when I introduced we started talking about the topic, it's a public health concern, right? It's not simply just, or never just, right? It's very, very serious. And I want to make sure that as healthcare workers, we know that. We should be asking about social isolation. We should be helping to identify loneliness and then making recommendations. And it might be to, reach out to your family more, reach out to, any resources that we might have in the community. You have some available, know some resources that you can have available for people to help mitigate the symptoms. So it's our responsibility as healthcare providers also to identify and mitigate these these issues with social isolation and loneliness.
Donna, we've talked about the people in nursing homes, and we've talked about older adults in the community. But I think another piece of this pandemic, another very important piece, has been the healthcare workers themselves, who have been exposed to so much really trauma in treating patients and being the last connection for many patients between life and death, since families could not be with them. So would you talk a little bit about the toll this has taken on our healthcare workforce?
Yes, absolutely. We're very concerned about the trauma that our healthcare providers have witnessed and what that is going to mean for their future mental health. From this point on, and during the ramp up and during the crisis, particularly in New York City when we were the epicenter and it came on fast and sudden, we weren't totally prepared. Now facilities, our government, we have a lot of support and we're better prepared. They have identified what we need to do in order to help mitigate the traumatic toll for our healthcare providers. And it starts with basic needs, not unlike our Maslow's hierarchy of basic needs. But for healthcare providers, basic needs, healthcare staff, we need to think about making sure that they have adequate personal protective equipment. So that is a basic need that we have to make sure is present, and it's much improved in healthcare facilities. We know that. We also need to think about, for these individuals, to make sure that other basic needs are present, that they have adequate sick leave, so they're not worried, and we don't have to worry that they feel the need to come to work sick and possibly, increase infections. Making sure that they have adequate transportation, that they have ability to have childcare. Those needs to be present for our healthcare providers. We have to make sure that that's present. We have to make sure that we have mental health support, because we do know that if we can't prevent the exposure to these traumatic experiences, actually call them secondary trauma, right? Because healthcare providers can feel the effects at a secondary level as if they were happening to themselves. So we have to make sure that we have group support as well as individual support. We want to make sure that there's insurance benefits so individuals can tap into these resources and stress the importance of mental health self-care for them. And the other piece that we need to make sure from a healthcare facility perspective is to make sure there's communication. Another piece that I heard from a lot of my colleagues personally is in the beginning, they felt like they weren't being communicated with. They didn't know what was happening. And since then, facilities have changed. A lot of facilities now have daily messaging that go out to their staff, to all staff, either via text messaging, via emails. Sometimes they're just inspiring statements, words of gratitude from their leadership, but they count. And also the conveyance of important information in a timely manner. So it's those three pieces: basic needs, mental health care, and communication really need to be present to help mitigate the further effects of traumatic experiences for our healthcare providers. If I can, Tara, I'd like to, and I know this is a topic that's near and dear to you, is to talk about one particular group of healthcare providers that we're particularly concerned about, and these are home healthcare workers.
Yes, those in direct caregivers in long-term care, because I always think these are the people that are the eyes and the ears of the older person that they're caring for. So please do talk about that.
And these are the individuals that are providing for the basic needs, right? So whether in their long-term care facility or they're going into people's homes, right? They're taking care of our most vulnerable elders. And we do know also that the characteristics for home healthcare workers are they're often women of color, people who are dealing with health issues themselves. So they're very vulnerable in and of themselves. And they, when we talk about that three-prong effort to mitigate the traumatic experiences, it's not so easy to deliver that to that group of healthcare workers. Recently, there was a study published in the Journal of American Medicine that looked at this group and talked about the special needs that they have, and sometimes very simple kind of interventions that we can do to help them, provide a form of communication, whether it's, having a availability to reach them on their personal cell phones, look at their assignments and their availability of transportation. So really taking in the special needs of that group and not leaving anybody out when we're thinking about how we have to take care of our healthcare providers.
Thank you for that note, which we will close on that note because it is such an important note, and the direct caregivers they're a group of people that just have a huge impact on the lives and quality of life of our older adults, and certainly must be recognized as team members within our healthcare continuum. And family caregivers also have been taxed by this pandemic, particularly with those who have had to take their loved ones out of nursing homes. Many people have chosen to do that and are caring for them at home. And I think many of the tips that you've given today will certainly help them as well move forward and know how to protect both themselves and the people that they love and care for. So Donna, thank you very, very much for sharing your wisdom and your knowledge with us. It's great to have you on board, and thank you everyone for listening. And we will be doing a series of these and hope to see you again soon. Thank you so much.